Did you know that getting straight teeth sometimes involves actual surgery? That's right. We're talking about procedures that you might never expect, like creating a hole in the roof of your mouth or adjusting your jawbone. And they aren't just cosmetic, they actually help to solve the issues that braces alone cannot. Hi, I'm Dr. Julien, your friendly orthodontist, and today we're diving into a surprising world of surgical treatments that go hand in hand with orthodontics. Let's start with one of the most common surgeries in orthodontics, and that's canine exposure. Permanent canines, also called the eye teeth, naturally erupt around the ages 11 to 13, but sometimes they don't erupt on their own, getting stuck or impacted in the gums or even deeper in the bone. And this can happen if there isn't enough space in the jaw or if the baby teeth have not come out on time. And when a canine is impacted, it's not just a cosmetic concern, it's also a functional one. Canines play a crucial role in chewing and guiding the bite, so their proper alignment is essential. And to help guide the tooth into place, there is a procedure called expose and bond. During this procedure, a small incision is made in the gum or the roof of the mouth to expose the impacted tooth, and then a button with a gold chain is bonded to it. And before we actually move the canine, we will create the necessary space using coil springs and braces, and once there is enough room, we gradually use the gold chain to guide the tooth into its proper position alongside other teeth. And sometimes we use an open or closed eruption technique for this process, depending on the depth of the impacted tooth. For a tooth that is closer to the surface, we can use an open eruption technique by making an opening in the gum and allowing it to erupt naturally over time. But when it's very deeper, we actually use closed eruption technique, covering the area after bonding the button and using orthodontic forces to bring the tooth into place gradually. After canine exposure, patient may experience tenderness or mild swelling, which can be managed with ice packs and over-the-counter pain relievers. It's also crucial to keep the area clean by gently rinsing with salt water or an antiseptic mouthwash. Full healing can take about a week, so avoid hard or sticky foods that can actually disturb the site. Now, let's talk about cases involving the molars, particularly when we need to either upright a tilted molar or expose an impacted one. Often we can upright a tilted tooth using orthodontics alone. But when the teeth is severely tipped, orthodontic technique may not be sufficient, and a minor surgical procedure can help speed it up. Uprighting the tilted molar is crucial for kids as it ensures proper bite and function, and for adults it's often necessary to create a stable base for the implants or crowns. Another common scenario is dealing with impacted second molars, which are molars that normally come in when you're around age 12. And if they remain trapped in the gum or bone, then we may need to actually extract the wisdom teeth first to create room for these molars to come in. Then we can expose and bond the bracket to that molar, engaging it with braces to gradually guide the tooth into its proper position. There may be some mild soreness after the procedure. It's worth noting that the gums can actually sometimes quickly overgrow on top of the exposed tooth, so making appointments on time is crucial to prevent delays in the treatment and avoiding the need for re-exposure. Now let's talk about TADs, which we use for cases requiring maximum anchorage. For example, if we need to retract a flared teeth significantly without affecting other teeth, TADs actually provide the stability that we need. They are also helpful for closing the gaps, like when a patient is missing a molar and we want to bring all the back teeth forward to close the gap. TADs are even used in cases of excessive gum show or gummy smile, as they allow us to control and intrude certain teeth, which can reduce the gum display without doing any surgery. And these small screws are placed temporarily in the gum and in the jawbone, and they act like anchors to direct the precise forces that standard braces alone cannot achieve. Since TADs are temporary, they can sometimes fall out or loosen, but we can quickly reinsert them to keep the treatment plan on track. Patient may feel mild soreness or sensitivity when the TAD is placed, which typically subsides within a day or two. Rinsing with a mild antiseptic mouthwash can help prevent infection, and it's also best to avoid touching the TAD with your finger or your tongue. Number 4. Orthodontic surgeries. Sometimes alignment issues go beyond the teeth and involve actually the jaw structures themselves. For patients with severe skeletal discrepancies, we turn to orthodontic surgeries or jaw surgeries. Take, for example, a patient with severely receded lower chin, also known as mandibular retrognathia. In cases of this, we may use a procedure called bilateral sagittal split osteotomy or BSSO advancement to bring the lower jaw forward. This surgery is essential not only for aesthetic balance, but also for functionality, as patients with misaligned jaw often struggle with chewing, speaking, and even breathing. Orthodontic surgery can be life-changing for patients with obstructive sleep apnea, as repositioning the jaw can help improve breathing and to reduce sleep disruption. Another common orthodontic procedure is Le Fort 1 osteotomy, which helps to adjust the upper jaw for better alignment and balance. Sometimes these surgeries can be combined with genioplasty or chin surgery for patients with a receding chin. By advancing the chin, genioplasty can further improve facial balance, achieving both functional and aesthetic goals. Recovery from jaw surgery takes several weeks to months, and patients are typically on a soft or liquid diet initially and need to follow strict instructions to avoid any strain on the jaw. Swelling and bruising are very common, but they subside within a few weeks, and physical therapy may be recommended to restore full jaw function over time. Regular follow-ups are definitely crucial to help monitor healing and to ensure that everything goes as planned. In conclusion, orthodontics is truly amazing. From simple braces to intricate surgical procedures, the journey to a healthy, beautiful smile sometimes requires unexpected steps. And while these surgeries might sound intimidating, they are safe, effective, and life-changing. If you've enjoyed this video, please like and subscribe for more insights on what goes behind the scenes in orthodontics. Thanks for watching, and as always, annyeong.